Well, good afternoon, everyone. I'm Dennis Stone, Director of the Center for Advocacy and Social Justice at the Urban League. Welcome to our Youth Mental Health Town Hall. This is one of a series of town halls that we have devoted to this subject. It's become increasingly clear in the surveys that we do and in the dialogues that we've had, particularly beginning with COVID, that this has become a serious issue. Always has been, but it is mounting in its magnitude, and we're therefore very grateful for those of you who have agreed to speak today and those of you who are joining us to learn more about this. Our goal at the Center for Advocacy and Social Justice is, in this particular instance, one of awareness, trying to make sure that people understand what the equity gaps are, and in particularly in this area. So with that, I'm going to turn it over to Jamie Krasnigor, our facilitator this afternoon. She's helped put this together, working with a great team from Sunshine Health and from the Center and the Urban League. And we're grateful for her work and the work of all of the interns at the Center. She comes to us from the University of Alabama in the area of public health. And so Jamie.
Hi, everybody.
Proceed.
So as Dennis had introduced me, my name is Jamie Krasnigor. I'm a student at the University of Alabama at Birmingham, working on my master's in public health with a concentration in health policy and organization. And together with Mariana, who is also a student at the University of Alabama at Birmingham, we're going to introduce the topic of mental health as it relates to youth mental health. And then I'll introduce our panelists and we'll go through a Q&A as well as any other questions that you guys have relating to youth mental health. And again, this is a 3-part series. So this is just our first part as an introduction. So starting with our introduction, or just a little agenda, we're going to cover what is mental health, why it's important in Duval County, because we are focused on Jacksonville, some warning signs of mental health distress, coping mechanisms, some daily activities so you can build some resilience to mental health struggles, and resources in our introduction. So starting with our introduction, mental health includes our emotional, psychological, and social well-being. While genes and biology are some of the uncontrollable factors that contribute to our mental health, our lifestyle and environment are elements that we have some control over. It's important to note that our mental health is a continuum, and just like our physical health, there are unhealthy and healthy behaviors that can lead to either good or poor overall mental health. So why is mental health such a big deal in Duval County? So the YRBS, which is a self-administered survey created by the CDC, is a good gauge for mental health and other risk factors. So one of the survey questions is related to bullying, depression, and suicide. So 40% of middle schoolers in Duval County reported that they are depressed, and about 40% of high schoolers, 40% of middle schoolers reported that they had been bullied, and then 40% of high schoolers had reported that they were depressed. And the depression indicator is only taken within the high schoolers. And then for suicide, about 31% of middle schoolers reported that they had seriously considered suicide. So this is a lot of young people who are going through some sort of mental health distress as a result of those contributing factors listed earlier. So now Mariana is going to go into some of those warning signs of mental health distress.
All right, so now that we have covered what mental health is and how much of an impact it has on the students in Duval County, we can talk about some of the warning signs that you can look for around the people in the people around you. And some of these are easier to notice. For example, if they have a change in their academic performance or they start missing school, and others can be more difficult to notice, such as them withdrawing themselves from social interactions because of their mental health or changing in eating habits. But these are important to look out for, since sometimes people don't even know their mental health is affecting their well-being. You can go to the next one. All right. And once you realize that you have mental health struggles, it's important to do things that bring joy to you. For example, like calling, texting, or hanging out with your friends to get things off your mind, or doing mindless things like listening to music or reading, writing, drawing, or painting, like trying to calm yourself down. And some really good things to do is get out of your mind and into your body. And you can do this by playing a game with your friends, joining a sports team, or dancing or singing. And it's important also to practice good sleeping habits, as it greatly impacts your mental health. And also it's important to reach out to a mental health professional if you're having trouble with your mental health and it's impacting your life. All right. And some of the things that you can do to build resilience and prevent yourself from getting to a point is by practicing these daily or weekly activities, such as eating nutritious, balanced meals. Also getting physical activity. It's more beneficial if it's outside, and this can be like 30 minutes of walking 4 times a week, simple things. Another thing you can do is practice gratitude. And one of the ways you can do this is by thinking of 3 things that you're grateful for every morning. It can be the smallest things, like having a cup of coffee in the morning, or going to bed early last night. Other things you can do whenever you feel like you can't really, you're not relaxed, is close your eyes and just breathing for 5 seconds, hold it in for 3 seconds, and then let it out, kind of like brings yourself back to your body. And another thing that people recommend is creating an affirmations list, like I am strong, I am beautiful, I am loved, and read it whenever you need it to, or like consistently. It doesn't have to do every day, but like make sure you're reminding yourself. And then now we have some resources. We have the 211 United Resource Hotline. And if you call them, they'll be able to contact you to some local resources in your community. You can also text the crisis text line, and they'll provide you with free mental health through text. And then if you ever see somebody who's being bullied, or you're bullied yourself, Duval County Public Schools has a hotline that you can contact. There's also the National Suicide Prevention Lifeline, and we have their number and website noted there. And then we have the Jasmine LGBTQIA+ organization in Duval County that helps support youths in Duval County by creating a community and advocating for them. And then one of our panelists actually works at Here Tomorrow, which is also another great resource. And their mission, as we can see, is to transform lives by building a community where mental health care is acceptable and accessible. And they do this by creating a community where people are heard, and they can reach that self-acceptance, and they don't feel like they're longer alone. Some of the services that they provide are also no cost, convenient, they're personalized, and they can be either in virtual or in person, which It's very accessible. And like I said, they want to create a community where you feel safe. So they are non-judgmental.
So now we're going to go into the Q&A, but before I do that, I'm going to introduce our panelists. So we have Dr. Nguyen, who is the Vice President and Chief Diversity Officer at the University of North Florida. He is also a licensed mental health counselor, a certified addiction professional, and an associate professor for the clinical mental health counseling. His research and community engagement focuses on the intersectionality of identity and traumatic stress, with an emphasis on marginalized social identity groups in the ways in which culturally diverse LGBTQ+ people negotiate their identities and manage their health. Our second panelist is Jessica Lumpkin. As a licensed mental health counselor at the National Certified Counselor, Jessica Lumpkin has a passion for providing the utmost quality of mental health services to children and adolescents. Jessica completed her undergraduate degree in psychology from the University of North Florida and her graduate degree in mental health counseling from Nova Southeastern University. She has 10 years of clinical experience across a variety of settings, including crisis intervention, structured outpatient programs, inpatient psychiatric facilities, nonprofits, the military, and private practice. Jessica's broad range of clinical experience working with individuals and groups during her professional career is in the following areas of coping skills, life transitions, children and adolescent, ADHD, anxiety and depression, behavioral and discipline challenges, anger and stress management, trauma and abuse, family and relationship issues, career counseling, parenting, self-image, and self-esteem issues. Jessica believes that learning to embrace your imperfections breeds confidence and produces freedom in loving who you are. Her motto is bloom, shine, grow. We are all imperfectly perfect. Our third panelist is Marcus Nelson, who is the Director of Outreach for Here Tomorrow. Marcus graduated from the University of Florida with his bachelor's degree in political science. As Mariana mentioned, Here Tomorrow offers a warm, welcoming, physical and virtual space to have conversations about mental health and receive guidance on what to do if mental health problems are getting in the way of you living your life. Marcus focuses on the growth of mental health collaborative and suicide prevention nonprofit as an organization on a regional and national level. He implements strategies and projects to advance the mission and broaden the impact of the organization. So now we're going to go into our questions and answers by our panelists, and I'll have Mariana introduce our first question.
Okay, so I'm just going to ask this question and you can feel free to unmute yourself and answer it. How do you feel COVID has impacted youth mental health?
I'll go first. Hello, thank you. Hello, everyone. I'm Jessica Lumpkin. You know, COVID was a very interesting time, even for myself. It really caused me to slow down, and also being a parent and also doing counseling with youth, it really caused everybody to kind of notice how they think, how they feel, how they act, which are all the elements of mental health. You know, from my personal experience, you know, coming, I guess, slowly out of COVID, I guess we still have some elements trickling on, but there has been consistent elevations of anxiety and depression and stress, you know, and it's very particularly for our African Americans, Latino, and LGBTQ plus youth, you know, and it's even more exacerbated when, you know, there's economically disadvantaged and also pre-existing, you know, mental health concerns. You know, during COVID, it allowed parents to kind of see firsthand what others were saying, you know, and parents also, put a magnifying glass on parents to show that they may not have the skills necessarily to deal with mental health. And also not being able to cope and help model those behaviors for their children. And so being able to not have those skills caused parents to also, you know, unfortunately, one statistic that I find that 55% of youth experience, you know, emotional and mental abuse from their parents during that time of COVID, being in their primary care. And so, you know, COVID, you know, it didn't necessarily like create the problems, but it definitely put a magnifying glass to show that these problems are there and even magnify them even more greater than what they are.
I agree wholeheartedly. And what I would add to what Jessica's already said is that Increased isolation contributed to some of those, that, same depression, anxiety she talked about, as well as the grief that young people were experiencing, grief from their own personal losses related to COVID, near losses, people who were very, very ill in hospital, maybe hospitalized for a long time, although they might not have died, but that is still that can be a traumatic experience of anticipating death or expecting a loss, and even vicarious losses, meaning that, if you're watching the news and just seeing the scores of people who were dying from COVID, and while the young people may not have known them personally, there's still a vicarious experience is being impacted by what you witness in someone else, even if it's not a direct impact to you. The increased isolation, the grief, for many young people led to what we call maladaptive coping patterns, meaning excessive uses of alcohol, tobacco, and other drugs, food, even over-exercising, or anything done in excess out of balance might be considered maladaptive, meaning not supportive of good mental and functional mental health. The COVID highlighted inequities. Dennis opened up and mentioned in his opening, mentioned something about inequities, and from a health equity perspective, we look at how, we look at a person in their environment and see what kinds of resources they have, and we can talk more about this later, but I think the COVID certainly highlighted the inequities in terms of who has access to care and who has the resources to pay for care. And I know that's one of the questions later. And then finally, what I will add to this question is that some of the professional issues that might have impacted youth's ability to access services, and meaning, do they have, not only can they pay for services during that time when they needed them, but what was the proximity of services? Proximity as an access issue, and then long wait times when they did have the ability to access either through insurance or paying out of pocket, how long did it take to get services? And I know that's an ongoing issue even to this day, even though we would like to believe that we're on the tail end of COVID. We would like to believe that. Long wait times for services is still an issue.
Yeah, those are both really great points that Jessica and Richmond made here. And just to very quickly expand on that, one of the other big issues that comes with that is the economic impact, right? We had so many people who lost jobs themselves, whose parents lost jobs, who lost access to services they might have had access to before. And people who, especially from an academic standpoint, who might have had to put schooling on hold or withdraw, and those changes in life plans is something a lot of people weren't prepared for, and that comes with mental health impacts.
Thank you all very much. So you guys brought up very interesting points that I had never thought of. Our next question is, how would you describe the state of youth mental health specifically in Florida?
It's tough right now. Just overall, it's tough, especially here in North Florida. It's very difficult, just because all of the things we already just talked about, and then of course you see kind of with a lot of recent events and the struggle that especially marginalized LGBTQ plus youth are going through. All of those different factors are really serious impacts on mental health and on people feeling like they're able to look for help and ask about it and not feel that stigma.
There was a study done by the Mental Health America, and out of 50 states, Florida ranks 38 in having the highest conditions of mental health and lower rates of access to care. One of the things that Dr. Nguyen had outlined, and then unfortunately, there's a big shortage in mental health providers, and a lot of families are forced to go to their PCP provider to get those help. And then even more, they go to schools, which is one of those questions that we have later on. but the schools are starting to feel the strain of having to deal with those mental health, issues, because children are showing up to school even more emotional vulnerable than what they were, having to deal with those traumas and probably still dealing with traumas, from the loss of family members, burden of taking care of other siblings, so Florida, having over 400,000 youth that have, unfortunately, emotional, behavior, and developmental issues, and not being able to access care is a very dire need within the state of Florida.
Mhm. And I will underscore the issues, particularly around with well, I was going to say particularly with LGBTQ youth, but it's also all youth of color who are being affected by recent legislation that is having a chilling effect on speech, about privilege, power, and difference, the thing that we want to deal with when we address health equity. So I'm talking about HB 7, I'm talking about HB 1557 that would impact. HB 7 impacts the speech around privilege, power, and difference, and HB 1557 impacts LGBTQ youth ability to, well, not their ability to seek help, but teachers and other trusted adults' ability to provide the kind of support they may need in the moment. And so they run the risk of being more isolated out in the open, if that makes sense. Right in front of us, they are more isolated because there's an impact on adults in their lives' ability to help them in places like schools and after-school programs and other places. The other thing is that the ranking, you mentioned the youth mental health ranking in Florida, but the funding for mental health, when we look at that by state, Florida is pretty low on the list, and it used to be number 50. I haven't looked at it in the last couple of years. A few years ago, I started reading a book titled Crazy. I know mental health professionals don't like to use the C word, right? But that is the title of the book. And the book is about the state of mental health, and particularly in Florida. And it's written from the perspective of a journalist whose son had been diagnosed with mental health conditions, and he struggled to get the care he needed and was in and out of the criminal justice system because he couldn't get into and stay in a mental health facility to get the help he needed. And he was also engaged in activities that landed him in the criminal justice system. And then the book focuses really on the real sad state of affairs of mental health in criminal justice environments. And so the lack of overall funding, the amount of money that we spend and direct toward mental health care for youth in particular is one of the things that is having a huge negative impact on youth mental health.
All righty, thank you guys. We can go to the next question. I know you guys have talked about this a little bit, but do you believe a stigma surrounds mental health?
Enormously. I mean, really, that's so much of what our organization is about combating that. When we say that our goal is to make mental health care acceptable and accessible, that acceptable is really all about combating that stigma and, saying that, it's okay to not be okay. And it's okay to ask for help. It's okay to talk about that and have those conversations, because you have to be able to, if you're going to start, working on it and making any progress with it.
Yeah, when you think about stigma, it also makes me think about, culturally, a lot of things have been passed down culturally and how you perceive mental health, and those people that provide those mental health, maybe they don't look like me, so they won't understand me, that internal shame that you may have, the whole policies and the government, and all those public organizations. they're making policies, but not necessarily taking into mind the cultural part of how people respond differently and they think differently. Some people have never been taught to say, I feel, fill in the blank. That's just a question that, like, you got to be strong, keep it moving, and so, the community disapproval of it, lack of trust, in the industry, maybe, my grandma didn't get treated right, or this therapist said something off-putting. And so it kind of sets you back, and not trusting it, and then also, spiritually, is also another one, praying it away. I know I was told to pray it away and, prayer can only take you so far. I love God, but but you need that other person to kind of step in. So dealing with the public stigma of, how people perceive you, that self-stigma, that shame, and that institutionalized stigma, about those communities and those systematic organizations around us. All three of those kind of, put a pressure on our youth, and believe it or not, they see and hear what we think they may not see and hear, but they do see and hear those things and are aware of what's going on around them.
Mm-hmm. All those things are on my list too. But one other thing I'll just add is one of my favorite things to talk about around stigma is I frame mental wellness and as mental hygiene. And I think because a lot of people, when I say the word hygiene, most people think physical. Probably you think bathing, brushing your teeth, combing your hair if you have hair. For me, I shave mine off. That's my good hygiene, is to shave mine off every day. But other people want to make sure they have enough on their head. And so most of us, it's just a natural, normal part of our daily rhythm is to do some things to take care of our physical hygiene. And I think we need to attend to our mental hygiene in the exact same way. That way we're preventing, hopefully, a lot of the distress that you presented on earlier. Now, I'm not saying that having a good mental health regimen will prevent mental health disorders, because that is that's really separate. A true disorder, diagnosable mental health disorder, is something that has to do with brain chemistry and so on and so forth. But for some of the distress that we experience, that youth are experiencing related to stigma, it might be dealt with through mental hygiene. So I like to ask, have you brushed your brain today? Have you brushed away some of those negative thoughts or those unproductive ways of thinking? Have you literally looked at yourself in the mirror and had a conversation with yourself? Or I should say, acknowledge the conversation that you're having with yourself and ask some key questions. Is what I'm thinking true? Do I have any proof to support what I'm thinking and what I'm telling myself? And even if I do have some support in what I'm thinking, is it in my best interest to keep thinking this way? What are the outcomes of this kind of thinking? How am I feeling? How am I behaving? So have you brushed your brain? Have you flossed your heart? Have you addressed the unresolved issues that might be lingering in your heart, like resentment and hatred and fear and anxiety? Have you dealt with those kinds of things that could impact your mental well-being? And what else do you do in order to stay mentally healthy on a regular basis, daily, several times a day? So think of how often you do something to attend to your physical health. Are you doing something just as often to attend to your mental health?
Thank you. Our next question is, what do you feel is the biggest barrier to youth accessing mental health resources? We mentioned cost, potentially it could be stigma, but what do you guys feel are the biggest barriers?
I would say knowledge, knowing where and when to seek help. If you don't know where to go, you don't know where to go.
Mm-hmm.
And so, and then, isolation was mentioned before, in my own personal practice dealing with teens. They like to be by themselves and cope by themselves. So that desire to kind of be by themselves, I got it together, and then also that lack of support from family members kind of even more put that barrier against you from accessing mental health. as well as, as we talked about costs and access to healthcare and those other, economically, things that may impact them from accessing that.
Yeah, I mean, those are absolutely incredible points. And really just to add to that, it'd also be kind of pointing out access. A lot of people, don't feel like, or sometimes just don't have the time in their schedules, the ability to get to a physical location where, these services are available. And a lot of, different services don't offer the ability to, have some kind of remote contact with people who are in that moment of crisis, or just in that general feeling of hopelessness, right? And that's why Out Here Tomorrow, we include those extra options. We include going by phone, going by text, even by video call like this. So having those options is one of the ways that we're trying to combat those barriers.
Mhm. And the only thing I'll add to that, to access point, is even with offering, like Here Today offers those the remote options, that some people don't even have access to technology. Even a telephone. We think most people, like, oh, everybody has a cell phone these days. Well, not everybody. So, but it's good that organizations like Here Tomorrow and others are offering a variety of access points. We need more than one way to get to the help that we need. And I've always been a proponent of telehealth and options. So, so good that, and this is a result of COVID, to be honest. COVID forced so many more organizations. There were a lot of organizations that were already offering telehealth, but COVID forced everybody's hand to figure out how to offer telehealth options. So.
Yes, I think those are all really great points. And like you said, COVID did make things a little bit easier, but also made it come to light how much of a lack of access there are surrounding a lot of other different things. Okay, the next question is, to what extent do you believe socioeconomic status impacts a youth's ability to access mental health resources? Okay.
Well, I'll start it, but because we've been talking about this, and one of the things I haven't mentioned so far, I mentioned insurance earlier, and that is a parity. Mental health and behavioral health, mental health benefits parity with medical surgical benefits if you have an insurance plan. And so for many years, we advocated to have the equal resources devoted to mental health in insurance plans, and as there are for medical and surgical needs. And a law was passed in recent years requiring parity. I can't say that has happened across the board. And so that's something that I think we should look more closely at, is for people who have insurance, do their insurance plans provide an equal number or amount of resources for mental and behavioral health needs as they do for medical and surgical needs. And having socioeconomic status can impact people. If they don't have insurance, then they are limited to a number of organizations that provide services, and it's not based on ability to pay. Again, like Here Tomorrow, I should get on the payroll in a little bit if I keep mentioning Here Tomorrow. So it's good to see that you provide services even despite the person's ability to pay, and so having access to organizations that provide those services is important. And I'll stop there.
Social economic status, it doesn't just, look at income and money, but also like educational, makes me think about occupational prestige, perceived social status and social class, and unfortunately, poverty is a real experience for a lot of children and families in the United States. And, poor mental health is linked to income. There's no way around it. It's linked to it. And if you don't have access, think about how many generations that passes down to, one after the other, experiencing those things. And then it just kind of makes me even think about like you can't even necessarily look at like socioeconomic status, but also looking at race itself, as a factor, and it's also one of those strong predictors of, them being able to access those resources. And so, being able to look at those minority individuals, they may experience symptoms that are undiagnosed, underdiagnosed, misdiagnosed, all simply because of stereotypes, historical perceptions, and misconceptions, and the list can go on. And so, socioeconomic status also has to incorporate the race part of it, because, economic privilege is one of those things that can allow people to access those services, knowing where and when to get those things.
Right. Yeah, absolutely. And, just to go a bit off that, and, a lot of times that socioeconomic difference is, where a lot of those stigmas start. Because if you're dealing with that, inability to afford that access, you're in a lot of cases going to try and say, well, the whole sour grapes analogy comes to mind a bit. You're going to try and convince yourself you don't need it. It's fine that you can't afford it, even if that's not true.
Yeah.
And then, on top of that, when you're looking at factors like, for example, if you're a young person and you have classes and you're working a job to pay for those classes, you might not feel that you can find time to go and, look at getting that help, right? And all of that plays a role in the ability to access and eventually in developing that stigma.
Thank you. So we mentioned the role that external factors have on seeking care, but what role do you believe parents and teachers have in children's mental health?
Children are very sensitive, and I strongly believe that they should be handled with the ultimate care. Childhood is a stage where they're learning so many things, and they're watching and they're modeling behaviors that are exhibited in front of them, and they're learning how to live, how to adapt a way of life, which is ultimately mental health, the emotional well-being and how to live. And so many times teachers spend more time with the children than their parents and then at home. And so teachers also see behaviors far more quickly than a parent, will see. Social emotional learning, which are one of those things that I think Dr. Nguyen had outlined as kind of being targeted a little bit within our policies. But it's important, and it really helps with emotional education and human development. And if students are taught to be self-aware, learning how to control their emotions, self-control, interpersonal skills, all those things can help learning take place. Maslow hierarchy of needs, it wasn't just created. Like you got to start from that bottom to get it. And if those things are not being met, how can education be met? How can learning take place in the classroom? So definitely teachers are in a unique position to help being able to notice and observe those behaviors, and being able to provide those teachers with that training to be able to know, what do I do when I see this in my classroom with this student, and also being able to kind of work with parents hand in hand. And that even goes into parents having that open communication with teachers and that dialogue, because they spend so much time with them, whether we want to face it or not. Parents, we are responsible for whether or not our child grows up with good mental health, skills, and being able to do that. And that goes into creating an environment in a home that is safe, that is loving, and so keeping an eye not just on the present, but also on the future, because these little babies are not going to be babies, they're going to be adults. And so what you're doing now is going to affect them long term.
Wow, beautiful. I will add that, obviously to adults, having trusted adults is so important for children because of all the things that Jessica just said. Unfortunately, not all adults are the safest, including some parents, including some teachers, and are always safe for kids. We would like to think that that's, more in the minority, but it's just, I don't know all the data on the number of issues that we have with parents and other adults not being safe for children, but we know that it does exist. Overall, parents and teachers really influence children's thinking and their value system. And so that is where you talked about, Jessica, there, those learning coping skills and those kind of things. This question made me think of a resource that is a resilience resource for children. And my sister, one of my sisters is a teaching assistant in kindergarten down in Duval County. And she introduced me to this video that they use in working with kindergarten students. And it's Pete the Cat. Has anybody heard of Pete the Cat? You've heard, oh, Jessica, Pete the Cat. I love Pete the Cat. So go to YouTube later and Google and just search for Pete the Cat. And it is in part a lesson about children learning the colors, but it also is about resilience and coping, because Pete the Cat is so cool. He just doesn't let anything bother him. And so I think those are, anyway, those are resources. I've been telling all my adult friends about Pete the Cat.
Now, it made me think about, as you can see, I have my inside out people.
I see that.
And so, being able just to take a regular book and being able to kind of talk to children like Pete the Cat, or Daniel Tiger, or, a lot of Dr. Seuss books, a lot of those books already outline some of those things. And so it's a good tool to kind of help start that conversation, because sometimes parents don't know how to start that conversation. So just taking what you do every day, don't try to reinvent the wheel, be present. And that's the other thing, just being present in their world, enter your child's world. Sit down and play with them, sit down at dinner and have those conversations. You'll learn so much and you'll be able to do that. So that, I think that was really cool. I like Pete the Cat too.
Yay.
Right. Yeah, I'll just add that, really for better or in some cases worse, that impact of that role is going to be huge, right? The stigma has to start somewhere. And in a lot of cases, it starts at home. It can start in the classroom. So, the impact there is, pretty big. And sometimes it's, those early mistakes that lead to, really big impacts down the road.
All right, thank you. And now that we have discussed the role of parents and teachers, our next question is, as mental health experts and providers, what do you see as your role in providing overall mental health in the community?
Right. One of the, as we were introduced, we see our role as really being that warm, welcoming space to have that conversation, right? For, anyone in the community who feels they need it to come and talk about their mental health and, talk about what they're going through. And that's what we have our whole team of peer support specialists here for. So, being there for the community, anyone beyond it. If you're going through something, if your loved one is going through something, we're here to help you through that.
Counselors can be found in neighborhoods, schools, agencies, inpatient, colleges, shelters, the list goes on where you can find them, and these clients show up to us looking help. They want to reap the benefits of getting that mental health, and so do no harm is one of the things that I really, hold true to, but also being able to provide those clinical mental health services that help people from all walks of life. And you have to be aware of the issues that affect the unique communities that you practice in. So if you're in a prison, what affects those prison, population? If you're in college, what are the main issues that affect students in college? Working with children and families. So you have to do the work. You got to study. You got to be up on the trends and the research that's going on. Because there's so many, issues, as far as in communities, as far as tragic events and experiences that these unique communities face. And then, a big one that's been going on now is these secondary traumas that they may not necessarily experience in themselves, but watching the news all the time, so parents really being aware of what your children is taking in can really help, with those things, and, as a mental health counselor, I don't only just, a lot of times when you think about accessing mental health, you think you have to have a disorder. or diagnosed, but that's not something, helping kids with coping with stress, understanding their emotions. We talked about bullying, social skills, just how to deal with my mama because she's not listening to me, anything that weighs on your mind, boyfriend, girlfriend, whatever you can think of, how you interact with the world around you. That's what my job is. And I'm not here to change the painting that is there. I'm just here to help you provide a different perspective and help you learn yourself and being able to interact with it. That's my role.
Mm.
Yeah, and just very quickly, actually, just kind of point out, the whole point there of lived experience, of knowing that, someone's been down that road, and being able to share that experience and helping someone who's, maybe at the start of that road.
Mhm.
That's kind of what, our peer support team is all about, having people who, have been through depression, have, in some cases, ideated or even attempted, made attempts on their own life, being able to, take that experience and say, you can get through it and I can show you how, is so valuable for a lot of people. And, so that's why we try to provide that in our experience.
Mhm. I think that's good for peers as well as us as adults being willing to share our experiences, whether it's with actual things like you're talking about, say depression or thinking of suicide, or our experiences with our own mental hygiene. I think it's important for young people to see that adults have to address our mental hygiene, our mental wellness on a regular basis. Not something you do, up till you get out of high school. It's ongoing. As long as you live on the planet, I think you need to be doing something. So I think it's important so they can see that, oh, if I do this, perhaps I can live to be their age, and beyond. So I think it's good that we are an example that way. I think participating in events like this, when possible, is important to do more formal and informal mentoring, taking someone under your wing, whether it's a young person who might need a trusted adult, or if it's, say, someone who's younger in the counseling profession or the mental health profession, or someone who's considering opening their own counseling service or counseling business, private practice, and they might need some help. So you might not be always providing the direct service, but you're helping to increase capacity by mentoring younger professionals, advocating when possible, and absolutely showing up to vote so that the people in Tallahassee and Washington, D.C. You have a greater likelihood of getting legislative support for mental health and wellness, rather than the constant draining of the resources that would go to support mental health and wellness. We need to vote in people who are advocates and who will fight to make sure that a fair share of the resources goes to mental health and wellness, and particularly youth and in education.
And even, right here in Jacksonville, when you have it's actually, I think just starting next March is when we start having local elections for our members of city council, our mayor, our sheriff, and all of those are going to have impacts in terms of mental health in the community.
Right. Yeah.
Thank you, guys. And then our last question that we have is how much of the youth mental health problem is related to resilience versus diagnoses? I know from my personal experience with some of adults who grew up in a different time, they say kids these days just aren't tough. They're not mentally tough. So how much of the problem is related to resilience and how much of it's related to diagnoses?
I think right off the bat, I think a lot of, I'm forgetting what the effect is called, but a lot of, what you see there with that idea of resilience is that, you're not seeing all the times that didn't work, right? You're not seeing all the people, who weren't resilient, who, unfortunately, had a different outcome. So, when people are kind of saying things like that, without really knowing the whole picture, it's really kind of hard to draw kind of an accurate perception.
I also think it's, ultimately it's hard to tell, how, because it's usually not either or, it's all of the above are contributing to youth mental health problems. But what I will focus on is the health equity approach that says, for a long time, we focus so much, particularly in public health, focus so much around individual factors, risk factors, protective factors, and increasing protective factors so that we can counter the impact of the risk factors and individual resilience. And we still, but that still needs to be a part of the equation. But the health equity approach says, in addition to individual factors and psychological pathways, we need to be looking at relationships and networks. What is that system of support around the person? What does their environment look like? And is their environment conducive of good mental health, or is their environment challenging? And is their environment a humongous risk factor for them? And then systems of power. And so we look at, again, going back to, Jessica talked about race and I'll say racism in terms of systems of power and who's in, who's out, what's good, what's bad, how much of that is weighing on our mental health, whether we know it or not. And so we need to be, I think, looking at the whole picture: environment, systems, structures, policies, procedures, socioeconomic status, as well as relationships and support, as well as individual factors. So we can't just only look at the individual factors. It's the big picture.
Yeah. And, resiliency won't make our youth problems go away as much as we think, it sounds good, be resilient. Like, well, how, so it's like, that part, the second part of the question, and then you think about, developmentally, social, emotional habits of well-being starts in childhood. And if those skills are not being taught from, day one, that also plays a part, in the diagnoses of mental health and not being able to access that quality of care, so, it's a big, bouncing ball. You want to be resilient, but then how do I access those skills to be resilient? They can be taught, but if I don't know where to get those skills to be taught, it's kind of like we're in this like hamster wheel that just keeps going and going around. And so I love, just being aware, advocating, putting yourself in situations and talking to other people. Sometimes if I see a group of youth, when I'm at the school, sometimes I just jump in and join the conversation randomly. I don't know what they be talking about, but I act like I do. I'm like, oh yeah, TikTok. I don't TikTok what, and just be able to just be there, and just, maybe I'm able, I may not be the one to see the flower bloom and grow, but maybe I was able to plant that seed or spark that, bit of knowledge. So as parents, or as adults, as, healthcare professionals, as individuals, as humans, just being present, with our youth and being able to lend that ear, and just be there for them.
Oh, and I just wanted to also point out, it's called survivorship bias, is what I was talking about.
So that concludes all the questions that we had written down before. I did see one in the chat of how are Duval County public school teachers prepared to recognize the early signs and symptoms of mental health distress in their students and the resources available to help youth and their family?
Every school that I know has access to full service schools. And so they can do a referral to full service schools, which is a service provided by United Way. And so most times when teachers are seeing those kids are having those issues as far as not paying attention or, traumas that they're seeing, they do have access within the focus account to refer that student to those services within Duval County.
Oh, I also see, it looks like we have Katrina Taylor,
hey, Katrina.
Behavioral Health here. Katrina,
Good
maybe you're
afternoon,
able to unmute
everyone.
yourself.
Hello, it's Katrina Taylor. I'm the Director of School Behavioral Health, so I oversee mental health for Duval County. And thank you so much for answering that question as relates to access to mental health services. Through a collaborative of KHA, DCPS, and United Way, all of our schools have access to a mental health clinician, and that came out of the Marjorie Stoneman Douglas Public Safety Bill for all schools in the state of Florida to provide students with mental health access. And our schools are trained in what's known as youth mental health first aid. The state requires all school-based staff to be trained in youth mental health first aid. And if any of you have gone through that training, it does not teach you to be a clinician. However, it does teach you to recognize what are the signs and symptoms that are indicative of a mental health concern and how to appropriately refer, how to provide the students with services until they are connected to access. So we provide teachers with training as well as accessibility to mental health therapists in their schools.
Awesome, thank you. Are there any other questions that anybody wants to ask our panelists before we close? I don't see any in the chat, so Dennis?
Thank you, everyone. Really want to express appreciation to our interns who made this possible, to Sunshine Health for their sponsorship, and most of all to our speakers and guests who I think exchanged some great conversation. We learned a lot. We realize a lot more needs to be done, but certainly we have people in Jacksonville and the greater area working on this issue, spreading the word on how important this is and how we have to pay attention, particularly to communities that are underserved and typically marginalized and don't get a chance to think about these issues as being equally important to them and to their families. So once again, thank all of you. Really appreciate your efforts, and we look forward to participating in other sessions like this as we go on through our series. So thank you very much, and I would just ask Jamie if I forgot anything that I needed to spread the word on.
I will be posting our youth mental health survey in the chat. So if you do know of any youth in Duval County that would be willing to take the survey just so we can get some real-time data, that would be awesome. So if you can share that. And just thank you again, Dr. Nguyen, Jessica, and Marcus for your amazing, insightful experience and knowledge. And thank you guys so much for your time.
Thank you for having us.
Yes.
Thank you so much.
Thanks, everyone.
Bye-bye.
Bye.
Take care.